Let's take you to Kisumu County, where the area has once again been plunged into a health crisis after more than 1,000 health workers went on strike over unpaid salaries.
Well, as the strike enters day 2, the workers are pushing to have 3 months arrears paid. That's salary arrears. This is translating to agony for patients who are now forced to stay at home or seek medical care in private schools. Let's now bring in Laura Otieno, who will give us more details. Laura, what more can you tell us about what is obviously a very worrying state of affairs in Kisumu County?
Well, indeed, Wahiga, there is total paralysis witnessed across all public health facilities in the county following the strike by health workers, which kicked off yesterday. So where we are right now is the Kisumu County Hospital, and we are at the outpatient sector part of it, where is a place that is usually flooded with mothers that are seeking prenatal and antenatal care, and also an area where children are vaccinated. But today we're seeing a very different scenario here, because there are empty benches, people have been shunned, and they're being told by the security officers that are manning this place to seek medical services in private facilities, because doctors, nurses, clinical officers, and as well as laboratory workers have downed their tools following the stalemate between themselves and the county over the payment of their 3-month salary and also the remittance of their statutory deductions, NHIF included. Now, we have been speaking to some of the people who have been directly affected by the strike. Remember, Kisumu County is one of the counties that is piloting UHC and has witnessed an influx of people seeking medical care from public facilities. I have a woman here who has quite a story, but karibia hapa Citizen TV. Umekuaje, umepata vipi venye ulikuja hapa? Angalia pale.
Mimi kwanzia nikuja hapa, nilifika hapa saa 1:30, sikupata mtu yoyote, hata daktari yoyote. Kuanzia mwezi wa 8 nilikuja, mwezi wa 8 sikupata daktari yoyote. Tena vile nimefika hapa tena sijapata daktari yoyote, na ninakuanga na ugonjwa ya sukari. Sasa sijui nitafanyaje. Naomba serikali iweze kutusaidia.
Okay, thank you very much. Well, as she has put it, there have been an intermittent strike of the doctors and nurses in this place. So there have been on-off in terms of striking, and the nurses in particular have a raft of issues with the county government, where they're indicating that the strike not only encompasses the issue of salary remittance, but also the implementation of the return to work formula, which they signed earlier in the year after about a month-long strike, which encompassed a lot of things, including the promotion of doctors and nurses and the general improvement of the working conditions in public facilities. So, of course, it is a story that we will be keeping our eye on, and we will try to look for the human side of it, because so far people are discharging their loved ones from the wards of this facility, and across the entire county in all is a similar scenario witnessed across all public hospitals and public health facilities. So for now, for Kisumu County, it is total health paralysis across all public facilities, but we will be bringing you up to speed with details as they unfold on the issue of the health workers strike here in this county, Wahiga.
Laura, just tell me this. I know that there are people who come from outside Kisumu County to access facilities, especially at the Jaramogi Teaching and Referral Hospital. What are their options now, especially for those who cannot afford private hospitals? Where else in the region can they move to? And of course, what's the cost of that?
Well, Wahiga, as you have rightly put it, it is quite a big issue, because Jaramogi Oginga Odinga is the largest referral hospital in the western region, and the hospital of a similar caliber is the Moi Teaching and Referral Hospital. So, of course, the worst hit especially are the cancer patients, because JOTRH usually offers radiotherapy sessions for some of the patients that come from across the region to seek services at that particular facility. So they should be moving, or they will consider moving to Eldoret, where they'll find a facility of that caliber. But then for those who are financially strained, then they will have no option but to seek services from private facilities. But some of the people that we have been speaking to have indicated that they will be going back to their houses, because remember, it will be an expense traveling to either Eldoret or even Nairobi, because they have been heavily depending on the UHC pilot cover, for which they've been getting medical services for free. So getting to travel all the way again to seek medical services elsewhere will be a big dig into their pockets, and some of them are saying that with the current economic status they may not afford that. So of course it is a wait and see game, and most of them retreating back to their houses and hoping that the stalemate between the county and the health workers will be resolved so that they can access healthcare. Wahiga.